Okay, so yeah, we're just gonna have to schedule for another appointment in the coming week, I think. Yeah, let me just go ahead and get those patient files pulled up for you. Yeah, so as you see here, just sign here on the lower part of the form to make the next part of your appointment, okay? Perfect, yeah, go ahead. Yep. Yep, just sign here, right there. Perfect, yeah. Okay, thanks, yeah, perfect. I'll put that in your patient file. I've got another patient here that I gotta attend to, so yeah, thanks so much. Yeah, your teeth look great. I'll see you next time. Sorry about that. I was just finishing up a dental cleaning with another patient, but now you have my full and undivided attention, so hopefully I didn't have to keep you waiting. So what can I do for you today? Okay. Yeah. Just here for basically a routine checkup. A little bit of pain in one side of your mouth. Okay. When's the last time you came in for an appointment? A little over 8 months ago? Okay. Let me go ahead and get my notebook here. I can usually pull up your patient file. Let me just see. Just kind of go flip through to your patient file. Let's see. Ah, there you are. I even had it with a little bookmark here. Okay. I'm just gonna, oops, as I throw my pen down, getting a little excited there. I'm gonna go ahead and just take down a couple notes, okay? But first, let me go ahead and just get on a pair of gloves. It's just before I handle any of the documents, you know. All right. And you can go ahead and have a seat in the chair, of course. I'm just gonna take a couple quick notes for your file, and then we'll go ahead and start taking a look at what might be going on in addition to your routine checkup. So, all right, go ahead. I know you've been here before, but give me your name again. And last name. Okay. I'm actually gonna have you look down a little bit. Okay. Don't mind the patient next door, they're a bit loud. He's on laughing gas right now, so. All right, and date of birth. And the year. Okay. Fill out this part of the chart real quick. Putting in your age. Gonna circle a couple things. Okay. Are you currently taking any medication? That's a prescribed medication as well as anything from over the counter? Okay. All right. I just have to ask a couple more questions and then we'll be able to start with the exam. Get this done. Okay. Do you have any kind of general anxiety or fear of the dentist? A little bit? Okay. It's understandable. Hopefully we'll make your appointment very relaxing today. It's supposed to be kind of calm. Just take a look at what's going on. All right. Have you had any kind of accident or traumatic injury to the mouth before that has caused the need for immediate dental attention or medical emergencies? No? Okay. No, I mean, that could be like a car accident or, you know, like a soccer ball or like a baseball to the face, something like that. No, nothing? Okay, good, good. Very good to hear that. Also, are you allergic to latex? No? Okay, good. We try to use latex gloves in my office, but sometimes we have to switch to nitrile just depending on the patient, so. Okay, that should be it for now. I'm going to keep your file off to the side, just in case I need to come back to it later. Okay, of course my pen is not wanting to cooperate. Hopefully you will be more cooperative than my pen. There we go. All right, so I'm gonna have you look up just a bit for me. Perfect. And what I'm going to do is I'm just gonna feel around a little bit around your jaw, just to kind of feel for any kind of irritation, any kind of sensitivity. And what that'll help me do essentially is just kind of document and feel around and make sure that I don't feel any kind of lumps or bumps, any kind of tenderness. If you do feel anything that kind of feels abnormal, or if there's any kind of pressure, just let me know. Try not to scream or yell, that can kind of startle me, but you know, just let me know, either with like a verbal noise or just like a hand cue. You can wave your hand or something if that's more comfortable for you, okay? So I'm gonna go ahead and just get a couple things ready here. Make sure these are good to go for later. Okay, so just what I want you to do is relax. I'm gonna lean you back just a little bit. Just a little bit more, like that, perfect. Okay, so I'm just gonna have you stay still for me, and I'm just gonna feel around your jaw. Just kind of feeling around. Okay. I'm gonna start on your left side. Just kind of feeling around gently. Let me know if you feel any kind of irritation or pain. I'm gonna pull on this side just a little bit. Okay. Okay, now I'm gonna go under your chin. Look up for me. Okay. Just kind of gonna feel around, palpate the area, you know. Sometimes patients get a bit of sensitivity here, especially if you've had like an allergic reaction to something in the food that you've eaten. You'll get some swelling here under your chin, and that can prove to be a bit uncomfortable. So just trying to feel around for that. Look for any kind of lumps or bumps. Okay. And lastly, I'm gonna look on your right side. Same as the left side, but just kind of gonna feel around, okay? Just stay still for me, you're doing great. Okay. A little bit of sensitivity there. What about if I do this right here? No? Okay. A little further back on the side. Right there? Okay. I'm gonna put that in your patient file. Here, hold this for me. Perfect, thanks. Okay. Left, right side. Okay. Turn your head a bit to the left for me. Okay. Okay. So we are going to have a closer look at that. Thank you for the pen tip back. And actually, what I'm gonna do is just adjust you a little bit there. Okay, perfect. So I'm not exactly sure what the root cause of that problem is yet. So what I'm gonna do is I'm gonna do an intraoral exam, which basically means I'm gonna be examining the inside of your mouth. We're not gonna get to the cleaning yet. I just wanna make sure that everything is you know, as healthy as it can be. We're gonna look a little further into that potential issue that you're having, okay? So I'm just gonna go ahead. These gloves are a bit tight, but I'm gonna go ahead and take these off. All right, give my hands a minute to rest. In the meantime, I'm gonna go ahead and lower you down a little bit, like this. I'm gonna take this dental bib. I got two by accident. I'm gonna just give you one for now. I'm gonna take this dental bib, okay? I'm gonna make sure it's unfolded. You can see it's a pretty thick material. Yes, you have to wear this. It's just for protection of your own clothing and just kind of keeping the workspace clean, okay? This is just gonna help catch any kind of drool or spit that comes out of your mouth during the cleaning, okay? Okay. Go ahead and stay still. I'm just gonna drape this on you. Okay, perfect. Need me to adjust a little bit? Okay, hold on. How's that? Better? Okay, good. Next, I'm going to just get my exam gloves ready here. These are a bit thicker latex. These will help protect my hands during the cleaning, okay? So, just gonna go ahead and put these on. These feel pretty good. They're a little small, but I find that the smaller gloves are more comfortable in the long run for examinations. Okay. Gotta make sure they're on nice and snug. Okay. So what I'm gonna do is I'm gonna take the dental mirror here, and I'm just gonna feel around in your mouth a little bit, okay? Just gonna allow me to take a bit of a deeper look into your mouth and just kind of see what that potential issue is, okay? I wanna make sure that we try to get to the bottom of this for your dental exam, okay? I'm gonna whisper a little bit just because I'm closer to your face, and I don't wanna shout or alarm you. I want you to be comfortable while you're in my office, okay? So I'm gonna go ahead and just have you open nice and wide. What happens if I tap here? Nothing? Okay. Just gonna look behind your teeth there. You do a pretty good job with getting the plaque off your teeth. That's good. Some patients that I have come in here just have really bad plaque buildup, and it's just, you know, it's not comfortable for them, and it's not exactly the most exciting thing for me either, getting that stuff removed. Let me just adjust my mask a little bit here. Okay. All right, I'm gonna go ahead and feel around. I'm gonna take the scaler tool out. We're not gonna get to the cleaning just yet, but I just wanna have kind of a good idea of what I'm working with here, okay? So I'm gonna go ahead and just feel around a little bit like that. Just kind of feeling around. Your teeth feel pretty good. No pain there. Remember, we looked on that side and I didn't see anything, so that's good. Okay. If I poke there, nothing? No? Okay, good. Okay, so I see a little bit of plaque buildup on this side under your lower incisors here, and while I'm just like lightly scraping, I can see a little bit of buildup, but it's nothing serious. What I'm gonna do, and your lips look a little dry. Do you need anything? Do you have any chapstick? You didn't bring any? Okay, hold on, I've got some. One sec. Okay, let's get the chapstick open. Let's get that mouth just a little bit. Okay. Your lips do look a little dry. That's the most painful thing ever, so go ahead and just kind of get that nice and cleaned up for you. All the way around. All the way around. Okay, pucker up a little bit. Okay, do a little bit more. There you go. Good job. Okay. Is that better? Okay, good. Okay, what I'm gonna do now is I'm gonna take my mirror tool here. And I'm also gonna take my scaler tool, and we're just going to basically scale your teeth a little bit and just get rid of some of the excess plaque, okay? It's not too much, but it's just kind of part of the standard dental procedure, okay? So go ahead and open wide for me. I'm just gonna check a little bit. Just gonna look around. Okay, the teeth look good so far. Like I said, just a little bit of plaque buildup, but it's nothing crazy. Okay. Yeah, I see it. Just a little bit, not too bad. Okay, so I'm gonna go ahead and put this mouth gag on you. It's just gonna help keep your mouth open so that you don't have to strain your jaw muscles while I'm doing the cleaning, okay? So just go ahead and open nice and wide for me. There you go, yeah. Just like that. Okay. How's that? Not too tight? Okay, can you go ahead and relax your jaw for me? Yeah, okay, good. All right, let's go ahead and do a bit of dental scaling, okay? So I'm gonna go ahead and use the mirror and the scaler, and I'm just gonna start scaling your teeth a little bit. Let's see. Okay, there's a little bit there. A little bit of bleeding, but that's pretty normal. Okay. I'm going to switch to this other scaler here. This one has a shorter tip on this end for your gum line, so I'm just going to use that just to kind of poke around. Okay. Let's see. Put nice and wide for me. Oh, that's right, you're already opening. Okay. Okay. What I'm going to do before we continue the scaling is I'm actually going to remove some of the deposits off of your tongue because I can see that your tongue is a little white. Normally that's not much of an issue, but the whitening of your tongue can be a sign of some different health issues that you might be having. Additionally, it's just good to brush your tongue when you're brushing your teeth. Do you brush your tongue? You don't? Okay. Well, that might be why you have some of the deposits on your teeth, so we're going to just try and remove some of those with this tool, okay? It's got some really soft bristles right there. See? They're pretty soft. They're not hard. They're not sharp or anything. They're nice and soft for your tongue. So I'm just gonna go ahead and open wide. Stick the tongue out a little bit for me. Okay. Just gonna kind of clean a little bit. It's pretty relaxing, yeah. As long as you don't trigger your gag reflex. But yours is pretty good. That's good. I don't want to make you feel sick, you know. Just gonna keep going. See, most of it's coming off, so that's good. Okay, just a little bit more. Doing a great job. Okay, gonna go ahead and set that in the autoclave over there. All right. Whew. It's a little warm in here. Excuse me, I'm gonna go turn on the fan real quick. Just for a little bit. Okay. Yeah, just kind of get the room aired out a little bit for you. Okay, so I'm just gonna do another visual inspection here. Just kind of check and see how everything is going. Stick that tongue out for me. Okay, good. Perfect. Okay. For now on that, now what I'm going to do is I'm actually going to get on some of my surgical gloves. I just want to try these actually. We can take a quick break. I'm going to go ahead and actually, let me take this out of your mouth for you. Okay. There you go. Okay, good. You need a tissue? Yeah, sure. Yeah, go ahead and blow your nose. Good. Okay, yeah, sorry, I had a nose run sometimes. Okay, you good? Okay. I'm gonna go ahead and just try on these surgical gloves while I'm, the nurse is gonna bring in a couple more things for me, so I'm just gonna put on these gloves to try them right now. These are size 6, as you can see. They're Protexus, they're pretty good. Okay, let's go ahead and get these on. Pretty pretty comfy. A little small on me, but they're pretty awesome. What do you think? You want to smell them? Yeah, go ahead and smell. Want another smell? Okay. I mean, I don't think it's that weird, but... Alright, let's go ahead and get the second glove on. Why do I adjust my fingers like this? Well, I mean, the gloves are kind of tight, so I have to make sure that they fit well, you know? Especially when I'm examining your teeth. I can't have a loose glove. It doesn't let me feel your teeth properly. Yeah, I do. I glove up 100 times a day, so I'd say I'm pretty good at it. Okay. Just gonna go ahead and feel around again. I'm gonna use the mirror just to kind of check your teeth again. All right. Perfect. Yep, we're just gonna adjust you a little bit more. There you go, perfect. All right, open nice and wide for me. Yeah, perfect. Okay. Damn, that dude's really on some laughing gas right now. Sorry about that. He's about to have his wisdom teeth removed. Okay. Gonna go ahead and just do the top left. Examine there. Top right. You're doing really well so far. The bottom right. Yeah, okay. Bottom left. Yeah, perfect. Okay, good boy. One more time. Let's go top left. Top right. Stay open for me. Yep, there you go. Okay, bottom right. Bottom left. Okay, perfect. Just gonna feel around again with my Explorer tool here. Just gonna kind of check the plaque again on this teeth. Just to make sure you don't have any excessive plaque buildup. That's not good. I want your teeth to be really healthy, you know? You have a little bit of plaque buildup here behind your center front teeth. Just gonna go ahead and try to get those out for you. Yeah. Okay. I know it hurts a little bit, but we gotta get all this plaque off. Yeah, just right there. This one part of your tooth is being really stubborn. Okay, let's see. I know you said you need some more. You need some more of this just to keep your mouth from getting dry. Sorry about that. Okay. Right there. Yeah, good. A little bit more. I know I'm trying not to do too much, but I know your mouth's getting a little dry from all the opening and closing, you know? Oh, you want me to put it on for you? Okay, hold on. All right, open. There you go. Okay. Yep, just right across the top. Yep, okay. Right at the bottom. Yeah, your lips get a little drier than most of my patients, but I just want to make sure they don't get cracked or start bleeding. That's when they get really irritated. Okay, a little bit more. Okay, well, obviously I've used these gloves, so I'm gonna go ahead and take these off. Try to use a bit of a sterile removal procedure, as you can see. So actually, I'm gonna go ahead and get changed up into some of my different gear for the next part of your dental exam, okay? So what that means is I'm going to put the dental tools here for a second, just kind of put them away neatly on the tray. And I'm gonna go ahead and switch masks real quick, okay? Okay, I'm back. Sorry about that. Just had to make sure I got my mask on properly. As you can see, this is a surgical mask, so it ties on instead of just going over my ears. Now I'm gonna go ahead and get my surgical gown on. Just gonna have you lower down a little bit. I'm gonna go grab that real quick. Just bring it back. All right, I'm gonna go ahead and put my surgical gown on for the second part of the dental exam, okay? So, That means making sure that the sleeves are the right way out. Like this. Normally my scrub nurse would be here to help me with the gowning, but today I'm on my own as we have the other patient in the other room having their wisdom teeth removed. So it's just me and you today, and that's okay. All right, so I'm gonna go ahead and just tie up the back here. I would let you help me, but I have to maintain a sterile field for the second part of your dental cleaning, so I'm just going to tie it myself. All right, I've got the top half on. I'm gonna go ahead and get the bottom half. Sometimes this is a little more difficult not having a scrub nurse or another assistant, but that's all right. It just means it takes the exam a little bit longer. Okay. All right, as you can see, I've got my surgical gown on now. I'm gonna go ahead and pick a pair of undergloves here. So I think I'm gonna go with these. They're a nice size 6. They're made by Biogel. These are some of my favorite surgical gloves. Look how nice this packaging is. Such high quality. Let's go ahead and open them. All right, there we go. Go ahead and open these, as you can see. All right, and I'm going to do the sterile clothing technique. So I'm going to go ahead and just insert my hand. Second glove's always a little tricky, but I'm gonna go ahead and just insert my hands like this. All right, nice and tight. Yep. Well, I prefer tight gloves, honestly, because they look better, they feel better, and usually they're more comfortable for me than a loose glove anyway. Just gotta make sure everything's nice and adjusted. These gloves are super thin, so they show every imperfection, as you can see. But they're quite comfortable. Just have to make a small adjustment there. I'm actually going to go ahead and put on this headlamp as well. This will just help me see inside your mouth while I'm examining your teeth at this level. So I'm going to go ahead and just put it on like this, and the light comes on. As you can see, it's very bright. Super comfortable. I can like use this in your mouth like that. Something fun like that. Okay. Let me go ahead and just take the scaler tool again, as you can see. Nice, super sharp scaler tool. And my mirror. I'm just gonna check around again, okay? Sure that everything looks okay. Okay. Gonna adjust this just a little bit. There we go. Yeah, okay. Teeth look good. You can see my reflection a little bit. Yeah. I'm trying to be gentle, okay? I don't want to hurt you, but at the same time, I have to do my job. Okay. Let's just see how that does right there. If I kind of check that. You've been really good for me so far. You've not really given me any issues. That's good. It's nice. Sometimes I have patients that come in and they're just super loud. Or they're like really scared of the dentist, you know? I don't want someone to be scared of me. I just want to help their teeth. I try to be as comforting as possible, you know? But, you know, I've had people try to bite me before. That's not fun. Go ahead and open wide. Okay, just checking there. Teeth look pretty good. Like I said, there's a little bit of plaque there. I just want to check. I'm actually going to use, let me get this filled up. Okay, I'm actually going to use a little bit of water. I'm just going to spray this in. Open nice and wide for me. I'm just going to spray it into that one spot, see if I can dislodge some stuff. Okay, get some more of this solution. Hold on. Okay, open wide again for me. Perfect. Okay, let's do it one more time. Okay, go ahead and just open really wide for me. I'm going to stick this way back in there. Okay, I think that got it. I'm going to check again with my mirror just to look. Okay. Yeah, I think that got it. It looks pretty spiffy so far. Okay. Actually, I'm going to go ahead. I'm going to grab this mouth spreader. I'm just going to put this in your cheeks, okay? I'm just going to kind of tuck it into your cheek pouch right there. There you go. Yeah, perfect. A little wider. Okay, yeah, perfect. I'm actually going to glove up with a second pair, two, just to put on, and yeah, you can have a look. Hold on. Let me just adjust the chair a little bit. Okay, yeah, see. Go ahead and put these on. These are really nice. They're very tight, but very comfortable. Okay, I'm gonna do a little more scaling on your teeth, but I think we're pretty good for the time being, actually. So let me go ahead and just raise the chair again. Good boy. Okay. So, nice and wide for me. Yeah. I mean, do you drink coffee? No? Okay. Well, there's a little bit of staining on your teeth right there, especially this spot. Here, I'll take a closer look. Because I got all the plaque off right there, but you've got a bit of like subdermal staining right there on some of the surface of your teeth. What you can do for that is try to not drink coffee before bedtime, and if you can somehow sleep and have coffee, make sure that you brush your teeth before bed. That's really important. As otherwise all of the food you've eaten from that day just kind of decays in your mouth, and that causes bad breath. It causes just not the best results, you know? So just brush your teeth at least twice a day, okay? Okay. I'm gonna go ahead and just use this scaler tool here just to kind of check. Okay. Yeah, let's see, we're getting there. Okay, so there's just a little bit of decay. It's not much, but it's enough that I want to try to make sure that I'm getting it, you know? Okay. That one spot's being a bit stubborn. Okay, well, let me go ahead and just fill this up one more time. Okay, open wide for me. There you go, okay. A couple more times. Just gonna get this liquid swirled around there for you. Good boy, okay. And let's try one more time. Open really wide for me. I need to get this last part here behind your front teeth. Okay, good. Perfect. I'm gonna go ahead and take a couple. I'm gonna take a look at that file again. Let's see if I can find it. Oh, there it is. Okay, yep. Yeah, okay. I got that in your file for next time. Perfect. All right, I'm gonna go ahead and just remove these gloves. Kind of like these, they're just nice and snug. Pretty comfortable too. And go ahead and remove this one too. Okay. Gonna go ahead and take this out of your mouth. We don't really need that anymore. Of course it's rocking now. Go figure, okay. I'm gonna have one more look with my mirror, but I think you're just about done for this appointment. Okay, yeah. And that swelling has definitely gone down. I think what it was just some inflammation from the plaque on your teeth. Okay. Yeah, I think we pretty much knocked that out, so that's good. All right, is there anything else that I can help you with today for your dental appointment? No? Okay. Well, I'm glad that I was able to be of assistance and just kind of check on that general issue for you. Sure. Yeah. Yeah, please come back anytime. If you have any concerns, call the office. My contact information's up front with the receptionist. You want to be a dental assistant? Okay. Well, I mean, I certainly wouldn't mind hiring you as an intern, but I need you to have attended a couple of dental classes first, yeah. Do we do workshops? No, we don't do dental workshops. That could be fun, I suppose, but, you know, technically people in the office have their masters in dentistry, so. I mean, a workshop is possible, you know. Yes, of course, gloves will be provided. We're not going to make you bring your own. Sure. Yeah, of course. Yeah, please. Also, at the when you go to pay at the checkout counter, there's a survey that you can take just to kind of let me know how your appointment went today. Your feedback is really invaluable to us as a customer. We value your business. Yes. Yes, and of course, if you have any issues that arise with that sensitive spot, feel free to call the office again. We're open Monday through Friday from 8 to 5. We have an emergency line as well, but we typically are on call over the weekend. If it's a real emergency, though, I would recommend going to the hospital. Yes. Okay. Yeah, I think we can make that work for an appointment in the future. Of course. Yeah, you like these? Me too. I like wearing all green. Yeah, sure. All right, well, I'll definitely talk to you soon. I hope you have a great night. Enjoy the rest of your day. And remember, just if you have any kind of sensitivity in that lower jaw of yours or anything with your teeth, just remember to try to call the office. But what you can do in the meantime is if you have inflammation or swelling, you can actually gargle some salt water and kind of get the salt water to mix in your mouth because it lowers the pH level. And that'll help fight infection as well, or any kind of irritation that you're having. Mouthwash does work as well, but the chemicals in the mouthwash can sometimes irritate small cuts. It does clean them, but you don't want to use it excessively. Salt water is a bit more of a natural pH balanced solution. Yeah, of course, don't swallow the salt water. I just want you to swish it and then spit it out. Yes, of course. Okay. Sounds like a plan. I'll talk to you next time. Thanks for coming in for your appointment. Bye for now.